found out that I was pregnant in April, which was 7 months ago, and I found out pretty early. Like, normally you don't find out for at least a month after you've been pregnant, and I found out like a couple weeks. So it was really fast, and it was surprising. It was really hard at first, like, to accept things, and I was scared, of course, because I'm pretty young, and I was just worried about what other people would think.
I found out a little bit further along. I was 6 months pregnant when I found out. So I went to Hope Clinic. I knew, of course, there would be a chance of me being pregnant, but the plan was to get an abortion. Went to Hope Clinic and I was sick, 23 weeks pregnant, which makes me 6 months pregnant. Didn't know what I was having, was planning on having an abortion, so I was not planning on keeping a baby senior year. So of course I went through with keeping my daughter that is 5 years old now. I gave birth to her March 19, 2014, and I graduated that following year, that June, with my class of 2014.
Going through high school being pregnant was a little bit different. I was put on bed rest, so I had to go on homebound and do school from my house until that was I was 6 months when that happened. So then before then I went to the alternative school to just kind of not have it as stressful as a time. And then 6 months I went into preterm labor 3 times. So I had to be put on bed rest and put on homebound services so I could finish school.
It doesn't make you weird, and there's a really big stereotype and like stigma around teen pregnancy that isn't true at all. And I honestly had it myself before being pregnant. If I saw someone who was my age who was pregnant, I'd be like, oh, like, you know, but it's more common to like take a different route. And so whenever people see girls who are pregnant at 16, it seems weird, but it's actually a lot more common than people think.
I would not change my pregnancy at all. I think I would have not given up and I would have gone to college right out of high school like normal. I think if I could go back, that would be the only thing I would change.
Go to the best support system you possibly think that would be good for you throughout the 9 months of your pregnancy. Ask for help. You're never going to be alone. Go to a teen mom that you know that had a child because they've been through it, so maybe they can give you some advice as well. That's something I wish I would have done instead of doing it all by myself and didn't say anything till I actually had my daughter.
I would just start off by like cutting negative people out of my life. So people who I know are probably never gonna support me in my pregnancy or in my lifestyle now. I would just say, like, it's really not worth the time at all because they're gonna bring you down, and eventually you're protecting your baby now, so eventually you're gonna get tired of it and you're gonna cut them out anyways, and it would probably save you a lot of energy to do it sooner.
Keep your head up. Don't give up. It is difficult. It's not an easy task, but it's well worth it in the end. Finish school, get your high school diploma, and figure out what you want to do.
Don't ever give up on your dreams. You know, of course you're going to be pushed back, but it's never too late to fulfill whatever you have that you want to be, and who you want to be is never too late.
I've learned so much about who's really there for me and who's not, and I have so many people, like I'm fortunate enough to have so many people who really do care about me, and I didn't really realize it as much before, and it's also helped me realize my purpose, like in life and stuff.
My daughter gave me life. I knew that I had a purpose, and I knew I had 2 little ones watching over me, that they were going to be, you know, my best friends for life, and I was totally okay with that. I was totally okay with if I was going to be alone with my girls. I was totally okay with that because I had 2 little girls that were going to be my best friends for life, and till this day we do everything together, and I love everything about them.
My parents helped a lot. They were there when I needed them the most, when I thought I would be scared to even tell them that I was pregnant my junior year. They were there, very supportive through the whole thing. When I finally had Landon, I went back to school and they were there watching him and back to work and all this stuff. So without my parents, I couldn't have done it.
I told my mom like the day after. So I'm really glad that I did that because just the sooner your parents know, the sooner you can like start doing things that you need to, like to protect your baby and stuff. There's just a lot of support. Like a lot of times you think that people would be made fun of or something for being pregnant so young, but there's actually, like, a lot of people will look out for you and let you know, like, hey, I'm here for you, that wouldn't have said it before. You can't be naive about it, but you do have to see, like, there are a lot of really amazing things that are gonna come with this.
So I'm a physician. I'm an obstetrician gynecologist, which means that I take care of women who are pregnant, deliver babies, and then take care of people all through their reproductive life. So we see people all throughout the pregnancy. In the beginning, it's every 4 weeks, and then it's more often. And what we do depends on what stage of the pregnancy people are at. We do like a full, complete exam at the first visit, and then until the end of the pregnancy, we don't do anything invasive or intrusive at all. We listen to the baby's heartbeat, we check the blood pressure, we check urine for protein and sugar at every visit, and then we do lab work at specific periods throughout the pregnancy to test for problems during pregnancy. And then we also do counseling and education, kind of on a little schedule of what needs to be dealt with each month.
So daily prenatal vitamin, very important, and it should include, and if it doesn't, you need to add a folic acid, just because you want to prevent the neural tube defects. That's very important. As far as drinking lots of water is really, really important. Watching what you eat is important. The number one cause of preterm contractions is dehydration, and a lot of people don't drink enough water to begin with. So that's a big thing, and so sometimes we have to educate and show this is how much you need to be drinking. Proper nutrition, because another potential complication is gestational diabetes. So, and I know teens sometimes have really poor diets. So that is another really important thing to look at and think about what you're putting in your body, because it can affect the baby and it can affect you.
So giving birth is kind of different for everybody, but universally it hurts. You know, you're having a baby and there's going to be pain involved. You have an option of having pain medicine or not having pain medicine, and the pain medicine can either be something in your IV that kind of dulls the pain, or something called an epidural, which is a little catheter in your back that will make you either feel less or feel nothing.
We have 24-hour anesthesia, so they're always available if you need an epidural, so we have pain control. If you want to go natural, we have lots and lots of support for that. People can walk around. We have a room that has a birthing tub. We have showers that are amazing, that have 3 jets that can aim at the lower back, and a lot of people use this for pain control, and then another that can go on their belly, so the warm water can be helpful with pain. If you choose to go natural, we do encourage a lot of walking, because laying in bed just makes you think about the pain and focus more on that rather than getting through the next contraction. If you have an epidural, then we have things like a peanut ball, and then once it's time to push, with the epidural, then we would do practice pushes, see if you can move the baby, and we kind of teach you how to push with an epidural, because when you're numb, sometimes it's a little bit of a process to kind of get the hang of it, so you're not pushing from your face and you're actually pushing where it needs to be happening. So we walk you through that. After baby's born, as long as baby's good to go, breathing, pink and all that, then baby can go skin to skin with mom. It
is the most overwhelming and amazing thing you'll ever experience. When you see your baby for the first time from the outside, it is a love, an unconditional love that you've never felt before, and you feel it with each child, so it's not unique to your first child. It's amazing.
So this is one of our support resources for young, unwed, unsupported, surprise pregnancies. So it's called Love in a Box. It's by a ministry called Embrace Grace. And what is in each box, there's an invitation. This is what it starts with, an invitation to some stories about a brave mom about keeping babies as a young teen. It even will support if you're choosing adoption. Little onesie that says best gift ever. And then also in here are there's a book by Amy Ford. It's called A Bump in Life. And she actually goes to my church, and she was a young teen mom. And so she tells her story and some other people's stories about being afraid to face parents, but didn't want to get an abortion. Talks about lots of stories like this. And so it is a brave thing, and you do need support, and this is one of the best resources that we can offer. Also, I was a teen mom. If I had had this support, that would have, while I had some support, there's nothing like having supportive people who've been there, who can talk you through the struggles, who can talk you through the hard times, they encourage you. There's nothing that can replace that. And so it is near and dear to my heart for that reason.
It can feel like you're all alone. It can feel like you're the first person in the world to go through it, but you're not. And you can feel like all your dreams have changed, like what your future is has changed. And it has, but it's not necessarily bad. Get care, learn what you need to learn, and you'll get through it. Yeah.
So my name is Holly, and I work at Hope Women's Center, and I'm the Chief Executive Officer here. So Hope Women's Center is a medical clinic for girls who find themselves in unplanned pregnancies, but we also provide STD testing and treatment. Hope Women's Center is located on 2740 Virginia Parkway, and we are both Suite 100 and 200 here in McKinney. Hope's mission is really to walk along the journey with a girl who finds herself in an unplanned pregnancy. So to provide education for her, so we've got 15 nurses that are part of our team. Some are paid and some are volunteer, but they're all registered nurses. And they come in and they provide care, medical care for our patients. And so not only do we provide the pregnancy testing, the ultrasound, the STD testing and treatment, but we also want to talk about options. So a girl, when she finds herself kind of in crisis in a pregnancy that she didn't want, wasn't planning, and she's absolutely freaking out, we want to sit down with her to talk about what are the stresses in her life, what do her relationships look like, what are the stresses, does the boyfriend know, is he applying pressure one way or another to keep or to terminate the child? There's lots of questions, and so we try to begin to find out what's really bothering her on the inside of her, and then be able to put people around her to support her in her decision.
You have your goals, but you're not going to be able to go point A to point B. Now you're going to go over the mountain and then maybe around a few more mountains, but ultimately you stay focused and you can reach your goal. It's just going to look a little different. The timing may stink, but this doesn't have to be the worst thing that ever happened to you. And I would say 99.9% of the cases, it is the best thing that will happen. It's not going to be easy, but it's going to make you stronger. It's very hard to tell your parents, but nobody loves you like your parents do. So I think once you tell your parents, everything else seems a little more natural and a little easier, and you can get the hardest part out of the way so you can start focusing on a healthy pregnancy. I think you just have to rip the Band-Aid off, and it's very hurtful, but as you tell them, you've had time to process and to think about it, but your parents have not. So your parents are going to say the first things that come to their mind. And sometimes they're hurtful things. But again, nobody loves you like your mom and dad. And they just have to get it out, breathe, let the night go by, and the next day they usually start calling the doctor and trying to find the best care for you, because you have to remember, you may be having a baby, but you are their baby.
You are not alone.
You are not alone.
You're not alone.
You are not alone.
You are not alone.
You are not alone.
You are not alone.